Khadija Robinson, and I'm at the Physical Therapy Clinic in Naval Station, Norfolk, and I'm joined by our special guest, Ms. Cecily Mills. Hi, Cecily. Thank you for joining us today.
Thank you.
First of all, we're going to go in depth about chronic back pains and how they affect people. So how often would you say that you treat patients suffering from back pains?
I usually treat at least 2 to 3 people every single day. Sometimes it's more, sometimes it's less, but every day I'm here, at least 2 to 3 people.
Okay, and what would you say are some of the leading causes of back pains?
Moving improperly, heavy lifting, sometimes it's sports, sometimes it can just be age, sometimes it's the mechanics or the structure of the back that causes back pain. But for most people, it's improper movement and lack of flexibility.
Okay, would you say that the back pains are treatable or are they most likely permanent?
Depending on what the cause is, if it's a structural problem like with your vertebrae or something like that, that's a permanent problem. You need surgery for that. If it's musculature, then you can treat that. You either do it with stretches or exercises, strengthening, things like that.
Okay. What are some options that you have for people suffering from back pains?
There are surgeries. We have people that get fusions if they have too much movement in their spine. You fuse them together so you don't have that much movement. There's disc replacement in between the vertebrae. There's discs in between there to soft, like cushions, and you can take that out and replace it with a new one. And then there's physical therapy, which is a less invasive form of treatment for back pain. So a lot of times doctors will send them here for physical therapy prior to doing surgery to see if that helps.
So would you say that there are ways to prevent back pains?
Sure.
Okay, thank you. And when we return, Cecily is going to demonstrate some techniques that could help us combat those back pains. And welcome back. Our special guest Cecily is now going to demonstrate some moves that can help us prevent back pains.
Okay, so I'm going to go through a series of stretches. Everybody can do them. It's important that you start doing these stretches now because if they get tight or you get stiff, then that's where your back pain starts to come in. Most people's back pain starts with malalignment, and these stretches help to correct that. First stretch I'm going to show you is a stand-in stretch for your hip flexors. Most people that stand with their back arched a lot, they have back pain in their low back, and the hip flexors is the cause of that. So the first stretch that you do for that, one knee down on the floor, the other one up high. You're going to tighten your stomach muscles here, and you're going to lean forward. And you should feel that stretch in the front of your leg going up into your abdomen. All of the stretches that I'm going to show you today, I want you to hold for about 30 seconds and do them at least 3 times. 1 time a day is great. If you can do them at least 3 times, that's even better. Okay, the next stretch is hamstring stretch. You can lay on your back, straighten one leg out, bring the other leg up, hold behind your knee, point your toes towards your nose. You're going to hold that for 30 seconds as well. Tight hamstrings can cause malalignment going the opposite way and then cause back pain that way as well. Another stretch to stretch out your low back and also the muscles attaching on your lower extremities or your legs is called the piriformis stretch. For that stretch, you're going to bend one knee, cross the other knee, cross the other leg at the ankle, pull in towards your stomach. And you're going to hold that for 30 seconds as well. Okay, so we've had 3 stretches. We've done the hip flexor, hamstrings, piriformis. The last one that I'm going to show you, we like to call it the angry cat and camel. For that stretch, you're going to start on your hands and knees with your knees shoulder width apart and your hands right underneath your shoulders. You're going to let your stomach droop all the way in, and you're going to hold that for about 5 seconds, and that helps to stretch the muscles on the front side of your spine. After you hold that for 5 seconds, you're going to arch your back all the way up, and that helps to stretch the muscles on the back side of your spine. So you're gonna do each of those stretches about 10 times, hold each one for 5 seconds, and then come back to neutral. So those are the 4 stretches that I have to show you. Hip flexor, hamstring, piriformis, and angry cat and camel stretch.
Thank you, Cecily.
Thank you.
We hope that the information that you provided and the exercise will be very helpful to our viewers. And for In the Know, I'm Khadija Robinson, and back to you in the studio.